There were reports of gunshots and burning of houses in the Bunkrugu district of the northern region Wednesday evening.
Well, over 4 houses were burnt in the renewed clashes between 2 factions, the Jafok and the Jamon. No casualty has yet been recorded. Later on today, we'll get our colleague Hashmin to give us more details of this. But it will be interesting to know that this happened at the time when curfew was right in place at about 8 p.m. Yesterday, Wednesday. And
so this thing will bring you a lot more details later on, either on this very program, but also on other subsequent ones we have on the channel. We have to talk trade issues, and government and the Trade Union Congress have agreed on reductions to the percentage levels in increments in electricity tariffs as implemented in December 2015.
The reductions are mainly aimed at mitigating the impacts of the recent tariff increases on the most vulnerable. The agreement was reached after a 4-hour meeting at the Flagstaff House on Wednesday. Minister of Employment Haruna Idrisu and Labour Relations represented government in the negotiations.
The parties agree and resolve on this day, 27 January 2016, as follows. That with effect from 1st February 2016, government will provide relief for the lifeline consumers and other vulnerable groups. The relief will translate into the following rates. So for those in the band 0 to 50, 45%, 51 to 300 band, 50%. Tariffs for all other consumption bands remains unchanged as an understanding. As agreed in 2013, the stakeholders have renewed their commitment to the implementation of the automatic tariff adjustment to avoid the large increases associated with non-implementation and its effect on incomes of households and businesses. And we have also agreed further that the ECG should within the next 2 weeks rectify all billing anomalies associated with the utility tariff adjustment that took effect from 14th December 2015. The parties will continue to engage, however.
The Ministry of Health is not planning a massive vaccination program for meningitis, despite the soaring deaths being recorded in the Bonafo region.
Health Minister Alex Segbefia says the focus is more on intensifying public education and providing health facilities the needed support to deal with the outbreak. He, however, says some vaccines have been procured.
Occurrence of meningitis in one area or the other, it does not necessarily mean that it is part of this particular strain of this particular strain that is going around, because you tend to find that meningitis will appear every once in a while in different areas, but it won't appear somewhere because this strain is out. Then people get anxious that, look, is it spread that far? It does come inadvertently in 1 or 2 areas, but I can assure you that a lot is being done to try and bring this under control.
Honorable, finally, is the Ministry of Health considering vaccines to do a nationwide vaccination?
Not at this stage. We have areas where this illness tends to occur, so we are aware of the catchment area, and this is after years of research and being victims of the disease. So we are going to, once we've brought this under control, we will then sit down and look at what we need to do to ensure that we don't get into a position like this. In 2011, there was quite a high number, over 1,000 people were infected, and then that led to us doing the vaccinations, and you would notice a steady decline from 2012, 2013, 2014, and then 2015. This has come up. Actually, the figures are not necessarily that high, or let's say as high as 2011, but because of the strain that we have, a lot more people have died than would normally if it was the normal that we are alive to. So we will look at it. What we need to do is first get this under control. Once we've got it under control, we'll definitely look at it. And if we need to do vaccinations in those areas, again, like we did in 2011, yes. If it's reached a stage where we have to... No, we have some vaccines. We are actually, as I said in the Public Accounts Committee, we needed to do some serious sole sourcing immediately to get some of the vaccines in. So in that regard, we do have some vaccines. When you decide to embark upon a sector or zonal vaccination program, then you have to look at the numbers and then do a proper procurement for that process. And if it's nationwide, it gets even bigger. But we will look at that when we've got this completely under control.
Are we waiting to record huge figures before we consider doing the vaccination for these areas?
No, we are going from experience as to what has happened in the past. History and experience is the best teacher. And we believe that at this stage, we should be able to bring it under control. We have to do a lot of education, and now people are going around doing that. But if you might use, for want of a better phrase, a sledgehammer to crack a nut, if you're not careful, at the same time, it may be that you get to a point where you say, no, where we are now, it's a situation where we should have to do a lot more. And now we don't just need a sledgehammer, we need a crane. And so that's the way. But you look at it based on history, and you look at what is on the ground now and what is happening, and then you take it from there. You notice that they are even talking of a different strain coming out. So for that reason, you have to be clear what it is that is actually causing it and where we are. And it's a bit premature to jump the gun. But I can assure you that there's enough expertise in the country to look at the problem. And as we go through it, the experts will inform us, and we'll take it from there.
And already, the Health Ministry has received in some 5,000 vials of antibiotics, which are said to be worth some 30,000 Ghana cedis from NS Chemists to support management of the pneumococcal meningitis outbreak currently being recorded in the Bonafo region. You have a lot more stories.
Yeah, we do.
Okay. We still have to remain on health.
And the Health Minister says details of investigations into a fire at the Central Medical Stores will be made public sometime next week.
And this comes exactly a year after the depot in Tema was razed down by fire. And all this was along with drugs and some medical supplies that were estimated to be in the region of some 300 million Ghana cedis.
Ghana lost its main drugs and medical supplies depot on January 13. The Central Medical Stores kept very licensed drug imported into the country. It took 3 days to completely put out the fire, and the monetary loss was put at over 300 million. Speaking to Joy News at the inspection of the temporal medical stores at Spinters here in Accra, the minister assured details of the report will be made public.
While we rebuild the new Central Medical Stores, hopefully at the end of this week or early next week, I hope it's at the end of this week, the report on the Central Medical Stores will be made public. And once that is done, we can give a little bit more light on what is happening with the Central Medical Stores. At this stage, I will not be passing any further comments.
Meanwhile, the Health Ministry has started receiving stocks for the temporal Central Medical Stores. Health Minister Alex Segbefia inspected medical equipment donated to the ministry to support maternal and health care across the country. The equipment delivered under the MDG accelerated framework includes fetal heart detectors, ultrasound basic scanners with video printers, pregnancy model series, and obstetric models, among others. The minister, during the inspection of the items at the medical stores, remarked that the items will be distributed to primary health care facilities across the country to improve maternal and health care delivery.
We had a target of 100. I believe 185 was the target. Over the next, from September this year when the agreements were signed, we now have the Sustainable Development Goals. Under item 3 of those goals comes healthcare, and the target now is 70 per 100,000 live births. So for every 100,000 live births, we do not expect to have more than 70 deaths in terms of maternal mortality. We agree that 70 is too many, but considering we are at about 319 at the moment, it's a long, tall order. We have 15 years to be able to achieve it, and this is the beginning. We have hit the ground more or less running. We have begun to get in the equipment to begin to deal with these issues. As you've seen,
35 anesthesia machines are also expected to arrive in the country next week for onward distribution.
Well, the professionals who assist the veterinary professionals within the service, the agricultural service, they've started an indefinite national strike over their market premium, a key factor in the computation of their salaries on the single spine pay structure.
National President of the Association of Veterinary Professionals, Emmanuel, says members are to stay away from bird flu investigations, vaccine preparations, border controls and meat inspections across the country. The veterinary para-professionals started a work to rule about a month ago, and the latest move represents a scaling up of their action. The national president spoke with correspondent Erastus Asari-Donko.
Across the country, all veterinary paraprofessionals in public service are withdrawing our services. What it means is that total withdrawal. Those are the borders who inspect animals before they enter the country are not going to do their work. Those are the livestock markets are not going to do their work. They have withdrawn their services. Those are the slaughterhouses. They are not going there at all. Those who are involved in laboratory, work, investigations, laboratory diagnosis, vaccine production, they are not going to go to work at all. Those who are also involved in outbreak controls, bird flu, anthrax, tuberculosis, all those outbreaks that are zoonotic in nature, those who are involved are not going to go to work. It also means that if you're a poultry farmer and you have a disease situation and you send it to the laboratory cannot help you with a diagnosis because the veterinary paraprofessionals are going to help the surgeon that is there will not be seen. That's implications also. Because last month, for example, the veterinary paraprofessional that generates data for our reports to international organizations did not present the data. So it meant that in December, there was no report. In January, it will continue. It has got serious international dimension and implications for veterinary services.
What serious dimensions?
It means that, first, you are not able to play your role in the international arena of helping to curb disease. You are part of an organization, the World Health Organization for International Animal Health. It means that OIE, it means that you cannot send reports. You can be blacklisted because there's a lot of technical support that comes from that organization to the country. So if you are not able to play your role, it means that you become a blacklisted member, and that has implications.
I will bring you a lot more on this very story, but let's look at this.
The latest corruption index has ranked Ghana 56th least corrupt out of 168 countries surveyed, with a percentage score of 47. Per the rankings, this suggests an improvement. A statement from the local chapter of Transparency International Ghana Integrity Initiative says the country retrogressed by 1 percentage point from the 48 points scored in 2014.
Government has, however, welcomed the report, saying it clearly contradicts earlier media report that Ghana was the second most corrupt country in Africa. The Executive Secretary of the Ghana Anti-Corruption Coalition, Linda Ofori-Kwafo, however, says rather than celebrate, Ghanaians must be worried about the latest report. She insists there are still high levels of corruption in the country, adding that most of the countries Ghana perform better than have not enjoyed the political stability Ghana has experienced in the last 2 decades and more.
Countries that are struggling to get back because of the difficulties they suffered with the war are countries that Ghana is performing better than. It's not something we should be very happy with. The CPI notwithstanding, last week or so there was a report from Trace International that said that Ghana is not doing well so far as fighting corruption in business.
This report, I mean, do you think is a reflection of how we are fighting corruption in this country? Is it really a reflection of that?
Corruption Perception Index is people's perception of corruption within the public sector. With the kinds of incidents of corruption we experienced in 2014, 2015, I would have been surprised if Ghana has scored better than 47 out of 100. It's a true reflection of the challenges we are having in this country. I will not jump because we are performing better than other countries. No, it is not a competition. It is how well you are able to put in place mechanisms to reduce corruption so that your citizenry would benefit, so you can attract businesses around the world. But if corruption is still high in our country, then it means that we are not doing well. And there are so many instances I can cite that I think government is not doing well. We will always say that government has done well when it comes to passing legislations, when it comes to having institutions. But even that one, we are not supporting them with adequate resources. So we have the institutions, we have the legislation, we're not enforcing the laws. The new trend in our country is when we ask people to refund monies that have been wrongfully paid to them. But we do not go after who paid the money wrongly.
The director of the Legon Center for International Affairs and Diplomacy, Professor Henrietta Mensah-Bonsu, says the current state of terrorism around the world ensures that, well, the president needs to be a lot more circumspect in taking a decision as to whether to invite the current ex-detainees into the country, just because the country is not a target for terrorists.
Well, she was speaking at the opening ceremony of the roundtable discussion on the implications of the ex-Guantanamo Bay detainees currently in Ghana, the Legon Center for International Affairs and Diplomacy.
Nobody invites terrorists. They come. So if you act as if they don't know of your existence and so they won't bother you, then you are setting yourself up for great difficulties, because I don't know of any country that has extended a welcome to terrorists to come and do terrorist activities. What happens is that if they decide that you can give them some political mileage, they will come. So you might as well prepare yourself for the event.
Professor Mensah-Bonsu also expressed optimism that this closed session of talks would make a difference in Ghana's future foreign policy formulation.
I think it will, and we intend that in a family atmosphere, the people we have brought together can discuss the things that matter to us as Ghanaians, and at the end of it, we will do a policy brief for government so that it becomes a productive interaction in the interest of Ghana.
So Professor Mensah-Bonsu is the director for the Legon Center for International Affairs and Diplomacy, and she concludes our news for the morning.
Yeah, that's it. When we come back, we're checking out the headlines that we have as captured by myjoyonline.com. We'll also take a visit to some news portals and see what they are reporting this Thursday morning.
Just stay on. We're taking a break. When we come back, the newspapers for you.